Crowe. Today we're going to go over why and how you should sell ancillary products with Medicare, and I'm going to try to keep this 5 minutes for presentation time. So a lot of this starts with the big changes for Medicare in 2025. It's going to make ancillary a priority, so we'll talk about the changes, why it creates a need for ancillary product sales, how to sell the ancillary, how to contract, and then I will answer questions at the end. Part D premiums for 2025, Part D premiums are going to go up a lot on all plans. The misconception with people is they think they're only going to go up a percentage. They are not. So our lowest cost Part D plans in 2025 are going to be in the $50 to $60 range. Your higher cost Part D plans are going to double in many cases. In addition to that, most PDP plans will be non-commission paying in 2025. This is all a result of the $2,000 drug cap and the fact that CMS put in the new rule that $100 needs to be paid on all PDP sales in addition to the commission. The only option the carriers have then is not to pay commission, and I feel pretty confident that's what you're going to see them do. Next big thing is it's roughly switching the cost on the PDP. The carrier right now pays roughly 30% of that cost. In 2025, they're going to pay 60%. The result is no commission, most likely, and much, much higher premiums. So what this is going to create is more interest in Advantage plans for current supplement clients. You have some clients that have plenty of money. They won't care about an extra $50 or $100 a month on their Part D plan, overall cost, but you have plenty that will. And you're going to have a lot of people that now will show interest in Advantage plans who didn't otherwise in the past. But on top of that, so you have people interested in Advantage plans that are supplement clients. As the agent, you're losing the commission on the PDP, so that hurts. Client, maybe a percentage of your clients no longer can afford the additional cost on the drug plan, so they're looking at Advantage plans. But the catch there is Advantage plans are going to have much more out of pocket in 2025 due to the things I just talked about and some additional ones. The star rating system has been changed for 2025. That is going to hurt reimbursements for carriers. You got the $2,000 drug cap, and the big one is you got mandatory dental implants on any Advantage plan dental. On top of that, you're adding the extra $100 to the commission, and the carriers are going to have to make adjustments to Advantage, negative ones for clients, to compensate for all of that. So Advantage plans are going to have in 2025 substantially higher out-of-pocket maxes, certainly less max dental benefits and ancillary benefits overall. They're going to have more cost share on expensive benefits, hospitalization and cancer, which are two big ones. Higher copays on medications. You're going to see percentages on tier 3 where we're not used to seeing that. And then higher copays on common benefits like doctor's visits, physical therapy, that type of thing. So you have Medicare supplement clients moving to Advantage. Your Med Sup clients are used to a high level of coverage, and now they're going to be moving to an Advantage plan that doesn't look like the plans we're familiar with in 2024. So when they do move to an Advantage plan and have a lot more out of pocket, they're going to have a lot more risk. That is where you're going to need to add hospital indemnity, cancer, and dental for them. Remember, you're going to be saving them a great deal of monthly premium going from Sup to Advantage. So soften that blow of the shock of the out of pocket by adding hospital indemnity, cancer, and dental. Keep in mind, cancer treatments are currently at 20% coinsurance. That might even go up, but chemo and radiation are 20%. That will quickly max out an Advantage plan. And you're going to be talking about Advantage plans that now will have higher out-of-pocket maxes. Hospital copays. Contrary to a lot of people's what they believe, hospital copays on Advantage plans do not have a 60-day grace period. So when you go in the hospital, you pay copays, you go back in a week later, you're going to pay copays again. There is not a 60-day grace period. That's only on original Medicare. So both are common ways people can max out their Advantage plan with the out-of-pocket, and that's going to be a much higher cap on the Advantage plans in 2025. Dental max benefits are definitely going to be reduced on Advantage plans. Because of that mandatory dental implant coverage, I think you're going to see a big impact on the overall max benefits on Advantage. So to address these things, what we talked about hospital indemnity, cancer, and standalone dental, what products can you add? GTL is a very common one. What's nice about them is they have both hospital indemnity and lump sum cancer available. You also certainly could use Aetna or Cigna. There's a number of others as well. We as an agency have a very high level contract with all of those carriers and can get you set up. What you're looking at for commission, direct pay commission from the carrier to you on an advance, usually 6 or 9 months with most of them. And the commission range is 50 to 70% of premium, depending on the carrier and product. For dental, you'd want to look at Delta Dental and possibly National Care Dental. Our Delta contract is unique. That will pay that will cover 50% of major services from day one. They don't need previous coverage, and it's 12% commission. If you want to look at NCD, that has it's not as good as Delta's network, but that has the MetLife network, which is a very good one. They do have waiting periods on major services, but they have much higher commission. They have a 21% street, and it can go a lot higher for agencies that want to contract. So we can accommodate contracts for individuals. We have agency level contracts for agencies, all direct pay. These companies will pay the subs, they will pay all the levels. So what I suggest is get set up, build this into your presentation, start working on it now, and you can make a lot of additional revenue and you can make clients very happy for 2025 because given the changes, I think this is going to be critical that agents are prepared to do this to work their existing clients for 2025 and for any new sales. Thanks for watching. I hope I kept it within the time range and have a great day.